Please go ahead.
Thank you so much, and good afternoon, everyone, and thank you for joining us today at our daily briefing. I'm Supervisor Hilda Solis, Chair Pro Tem, Los Angeles County Board of Supervisors. Today, you're going to hear from Dr. Ferrer, our Director of Department of Public Health, and in addition, Joe Nikita, Director of our Department of Consumer and Business Affairs. Yesterday morning, the LA County Board of Supervisors passed a motion to expand the tenant protections provided in the county's eviction moratorium. This was a momentous action that will ensure the health and safety of thousands of families across the county who are facing great economic challenges, and many, as you know, are on the brink of homelessness. The changes to the eviction moratorium include the following: expansion of protections beyond unincorporated areas to all cities in the county, except those cities that have their own eviction moratorium. Extension of the repayment period for past due rent from 6 months to 12 months. A rent increase freeze for residential units subject to rent stabilization in unincorporated communities. A prohibition of evictions based on unauthorized occupants, pets, and nuisances related to COVID-19. And acceptance of self-certification from tenants for inability to pay rent. These changes will be retroactively effective March 4th of this year. And according to a 2018 study by the Economic Roundtable, it's estimated that about 600,000 Angelenos spend more than 90% of their income just on housing. These severely rent-burdened households should not have to decide between paying rent or putting food on the table. The strengthening of the county's eviction moratorium will help struggling households make ends meet and keep them from falling into homelessness. Additionally, to further assist tenants as well as landlords, the Board of Supervisors passed a complementary motion authored by Supervisor Hahn, which would establish a rental assistance program for those in need. I co-authored the motion with Supervisor Hahn to ensure we're doing what we can to help both property owners and renters. This rental assistance program will leverage federal funding along with philanthropy and private dollars in order to make landlords whole and to ensure tenants are current on their leases. The LA County Development Authority will return in 30 days with the recommended framework for the rental assistance program. And I know that property owners and other businesses have carried heavy burdens over the last few weeks and will continue to do so through this crisis. I want you to know that the county is here to assist you, and I'm pleased to announce the county's partnership with Goldman Sachs and the Community Reinvestment Fund to make $15 million available to provide Paycheck Protection Program loans available to businesses. Businesses without a traditional credit or banking relationship or that have been unable to pay for the Paycheck Protection Program will be able to apply for this program starting today at 1 p.m. For more information about the program, please go to the Business and Worker Disaster Help Center website at lacountyhelpcenter.org. On Monday, earlier this week, the LA County Development Authority launched another relief package called the Business Recovery Loan Program. This program offers up to $20,000 to help businesses cover employee payroll, sick time, operations, and outstanding business expenses. Qualifying businesses must be located in the unincorporated community or certain communities that participate in the Federal Community Development Block Grant Program. The county is also working on a larger economic relief program for businesses that will launch in the next few weeks. And additionally, yesterday, our Department of Consumer and Business Affairs launched a program to provide enhanced foreclosure prevention services for property owners and landlords with 15 or fewer units. Through this program, our counselors can help property owners affected by COVID-19 work with their lenders to, 1, secure forbearance plans, reduce or delay payments, 2, establish repayment plans for missed payments, 4, take advantage of loan modifications, and 5, explore programs unique to lenders. Counselors can also assist with filing complaints from various city, state, county, and federal moratoriums. Information about these foreclosure prevention services, as well as our economic relief programs for property owners and businesses, can be found through the county's Business and Worker Disaster Help Center. To access those resources, please visit lacountyhelpcenter.org or by calling 833-238-4450. In conclusion, our county departments are working diligently to provide every support possible to all of our county businesses and residents, and I urge those in need of this assistance to please seek it out. Next, I'm honored to introduce Dr. Barbara Ferrer, our Public Health Director.
Good afternoon, everyone. Thank you so much, Supervisor Solis, and to the entire Board of Supervisors for protecting the health and safety of all Angelinos during this unprecedented time. I'm going to update you on our current status, starting with the sad news that we're reporting an additional 42 deaths today. Again, this will now be the highest number of deaths we've reported for any single day. 24 people who passed away were over the age of 65, and 13 of the folks who were over the age of 65 who passed away had underlying health conditions. 11 people who died were between the ages of 41 and 65, and 7 people between the ages of 41 and 65 had underlying health conditions. There was one person who died who was between the ages of 18 and 40, and this person also had underlying health conditions. This is a reminder that while mortality rates are higher for people who are older and people who have underlying health conditions, people of all ages can in fact pass away from COVID-19. We don't have information for 6 cases as they're being reported by the city of Long Beach, who had 3 additional deaths, and the city of Pasadena, also with 3 additional deaths. This brings the total number of deaths to 402 in LA County, and our mortality rate for COVID-19 remains at 3.8%. For the 330 deaths where race and ethnicity has been identified, 15% of the people who passed away were African American, 17% are Asian, 34% are Latinx, 31% are white, and 2% are identified as belonging to another race and or ethnicity. And I again want to note that we continue to see patterns of disproportionality related to the total numbers of people in our population compared to the total numbers of folks who are dying of COVID-19. To all of you who have lost families and friends to COVID-19, you're in our thoughts and our prayers every day. I'm very sorry for your loss, and I wish you all peace. Today, we're also reporting 472 new cases. Over the last 48 hours, we've reported 1,142 new cases. There are 10,496 total cases across LA County. These cases include 363 cases that were reported by our partners in the city of Long Beach, and 179 cases reported by the city of Pasadena. Both cities have independent health departments. We're also reporting 28 confirmed cases amongst people experiencing homelessness. The majority were unsheltered. There are 6 who were sheltered, and they're appropriately isolated, and close contacts are quarantined. Of the 6 who were sheltered, 3 were sheltered in the same facility. We also have hundreds of people who are experiencing homelessness whose status, who are persons under investigation, or they're people who needed to be quarantined because they had an exposure, and these people are also either isolated or quarantined at this point in time. There are 2,704 cases that have at some point in time needed to be hospitalized. This amounts to 26% of all people who were diagnosed as positive for COVID-19. There are 1,501 people who are currently hospitalized with a positive diagnosis for COVID-19. 31% of the people who are hospitalized today are in the ICU, and 19% of the people hospitalized today are on ventilators. You can see an updated report of the LA County cases on the Department of Health's website. That's at publichealth.lacounty.gov. We're currently investigating 205 institutional settings with at least one confirmed case of COVID-19. This is 7 additional investigations since yesterday. These include nursing homes, assisted living facilities, shelters, treatment centers, supportive living, and correctional facilities. The total confirmed number of cases in institutional settings is 1,764. This includes both staff and residents. 940 of the cases are among residents, and 824 are among staff. And I'm sad to report that 133 residents who lived in institutional settings, primarily this is skilled nursing homes and assisted living facilities, have passed away from COVID-19. This represents 33% of all of our deaths. We have assigned additional Department of Public Health staff to increase our support to nursing homes and assisted living facilities. And we've also assigned a team to help ensure that all of the employees have adequate PPE, personal protection equipment. We're also going to be working with the nursing home providers to increase the number of sites that can serve COVID-19 positive patients exclusively who need to reside at a skilled nursing facility or an intermediate care facility. We're reporting 70 confirmed cases that have occurred at some point in our jail facilities. This is 15 inmates and 55 staff. The Sheriff's Office is reporting for their facilities that there are 13 current inmates that have tested positive. The 2 additional inmates, as I noted yesterday, have recovered. 35 inmates are in isolation, and 603 people who are in our jails are quarantined. There are 34 cases in the state prisons. This is 23 that are among inmates and 11 among staff. And we remain at 4 cases in our juvenile facilities, and these are all among staff. We do post a list of the facilities with confirmed cases on our website once they have notified all of their staff, families, and residents. We will continue to see an increase, unfortunately, in the number of people that live in our institutional settings that are infected, and also in the number of people that provide services to people who are residents at these facilities. The staff, many of whom are healthcare workers, others who are ancillary workers, and we thank everyone who's working hard, again, to prevent spread at institutional settings. These are settings where the job is particularly difficult since many of the residents may have underlying health conditions. The Los Angeles County Sheriff Department is reporting 32 positive cases among staff. There are 432 staff that are quarantined and 250 staff that have been able to return to work. The LA County Fire Department is reporting 16 positive cases among staff, 17 people who are isolated in their homes, 3 who are at home sick and in isolation, and 13 who have returned to work. I want to again express my gratitude to Sheriff Villanueva and Chief Osby for tracking and reporting this data. Today I'm happy to report that over 67,000 people have been tested and had results reported to the LA County for COVID-19. And I want to note these are folks for whom we have an electronic lab record. 11% of all of these folks who got tested were positive. And as I noted yesterday, we now have completed getting the backlog of negative cases that hadn't been submitted through electronic reporting. There are new testing sites that are opening this week, 3 today, and this will increase our testing capacity for symptomatic people who live anywhere in the county. And I do want to note on the testing numbers, we're only reporting the data that's confirmed through our electronic lab reporting system, but there are also other ways for people to report positive cases and negative cases, and these are coming in from labs that don't have the capability to report to us through our electronic lab reporting system. So there are some positives that don't line up every day. We do try to catch up over time, but I want to note that there is a difference in some of our numbers, and it's because we want to have really accurate number on the lab testing, and those are the numbers that we're getting through the electronic lab reports. I do want to talk for a minute about what recovery will look like here in LA County. And as I mentioned yesterday, certain strategies must be in place as we begin to lift our health officer orders safer at home later on in the month of May in most likelihood. The safer at home order is a significant tool to mitigate the spread of the virus in our community. And that is that it allows us to practice physical distancing to slow the spread and prevent people from becoming infected. And I thank you all for the role you've played in doing this. And we will continue to need physical distancing requirements and directives in many months to come. But what we're going to be working on as part of our recovery is figuring out how we can, in fact, get more people back to work. I do want to note that the other key effort on making sure we slow the spread is containing the virus. And this relies heavily on being able to find people who are infected so that they can then isolate and identify their close contacts who would be able to quarantine. At this point, if we think about at some point in the next few weeks being able to relax some of the community mitigation that we've asked for in our health officer order, we have to be able to continue our containment measures and even strengthen them so that we're in fact identifying new sources of infection immediately, isolating people who are infected, and ensuring that their close contacts are quarantined so that we avoid the spread of COVID-19 in our communities. And even as we think about the future, when we know more businesses will be able to open, I want to note that things will be very different. Physical distancing will still be a very important part of recovery. And I want to give some examples of what this might look like. More retail shops will be open at some point in the near future, but there will be limits on how many people can be in a store at any given time so that people who are there can maintain a lot of distance between themselves, other people who are there, and employees. Our arts and cultural sites will reopen at some point in the future, but events may be spectator-free, and exhibitions will require, again, physical distancing, meaning that there will be many fewer people that will be able to view any installations at a given time. And the trails and the bike paths, when they're able to be reopened, they may need to be one way so that people can keep physical distance from one another. And you will see infection control practices like hand washing, wearing cloth face coverings, and physical distancing require at all of our public places and spaces so that we can do our part to maintain and slow a spread. Some locations, you may even see that they're taking people's temperature before they're entering a facility to ensure that people are fever-free and symptom-free. Our goal, which we share with you, is to get as many people back to work as possible. But we also need to make sure that we do this in a way that protects all of the employees, employers, and customers. I also want to update you on the seroprevalence study that I mentioned last week. A random sample of 1,000 adults residing in LA County were tested for COVID-19 last weekend using an antibody test, and that's also called a serologic test. This is very different from the tests that people get to determine if they're positive or negative for COVID-19. These antibody tests do not detect virus, and they don't diagnose someone who is currently positive for COVID-19. What it does is it measures antibodies to the virus, and this allows us to know whether a person's body has already mounted a response to the virus. It gives us valuable information about how many people have been infected over the last few months throughout LA County, regardless of whether they ever became sick. And we will continue these surveys by doing them approximately every 3 weeks, at least through the summer. We're also hoping that we'll be able to expand this surveillance data collection strategy in some of our more vulnerable communities and do some targeted studies in groups that are higher risk, such as healthcare workers, first responders, staff and residents at skilled nursing facilities, and those living and working in other congregate settings. This information helps us understand how COVID-19 shows up in our communities, but it doesn't help us diagnose who is positive for COVID-19 at this particular point in time. There are no serology tests, none, that are approved by the FDA for use as a diagnostic tool. So when you talk with your providers, you need to get the appropriate test to determine whether or not the virus is present inside your body at this point in time if you're symptomatic. And that is the molecular testing that's offered at all of our many testing sites. Please do not fall for the scams that are out there that offer you a serological test, an antibody test in your home. There are no FDA-approved home tests for antibodies. So I know there's a lot out there. It's sort of a little bit of a show and a game at this point, but I hope you all know if it's not an FDA-approved test, and if you're not working with your provider to determine whether you need to be tested, you should stay away from products that are marketed under false pretense. I'm with you in all of the steps that we need to take to slow the spread of COVID-19, and I'm also with you in being anxious to start our recovery planning. I want to thank you for all that you're doing, staying home, practicing physical distancing, wearing your cloth face coverings, and self-isolating and self-quarantining when necessary. I know it takes a lot of time, and there isn't a single person in our county whose life hasn't changed because of COVID-19. The sacrifices you've all made really can't easily be counted. I know some people have lost loved ones. Some people have been extraordinarily ill. Some people have lost their jobs. Some people had to temporarily close their businesses. Some people are struggling with the new task of helping to guide their children through remote learning. And all of us have had to live our day-to-day lives very differently than we're used to. But I ask you to please continue to do your part. Stay connected with your community from afar. Be kind to yourself and show compassion for one another. I know we're going to get to the other side of this together. And now I'm going to introduce Joe Nikita, the Director of Consumer and Business Affairs.
Thank you, Dr. Ferrer. Good afternoon, everyone. Again, my name is Joe Nikita, and I'm the Director of the county's Department of Consumer and Business Affairs. Let me first acknowledge the confusion, frustration, anxiety that you might feel as a landlord or tenant living through the COVID-19 pandemic. A lot has happened, certainly in a short amount of time. We're doing our best as government to respond to the crisis in a timely and appropriate way, and given the circumstances, certainly things are unfolding and changing very rapidly. So let me reaffirm my commitment and the commitment of the county and our city partners to provide you with the most up-to-date information and empower you with accuracy so that you can take steps to protect your own rights and understand your obligations under the changing rules. I'm going to double back a little bit on some of the stuff that Supervisor Solis mentioned and take a little bit of a deeper dive. Yesterday, of course, as Supervisor Solis mentioned, the Board of Supervisors put in place new rules for landlords and tenants. The rules will apply to all residential and commercial tenancies and any mobile home space renters countywide in every city unless, and this is a big unless a city has already adopted its own eviction moratorium. So if you live in a city that has already put an eviction moratorium in place, we are not changing the rules on you. We are not going to add to that confusion. There are about 35 cities that already have an eviction moratorium in place. We are listing those on our website, which I will give you at the end of my remarks. So the rules I will be speaking about today will not apply to you if you live in a city that already has an eviction moratorium in place. The Board of Supervisors adopted rules yesterday that are designed to prevent residential and commercial tenants and mobile home space renters from being displaced or evicted if they can't pay rent because of COVID-19 or a COVID-19 related hardship. And this includes storage units, by the way. If you have a storage unit or you are a storage company, the moratorium applies to you. The rules protect tenants from evictions if they have additional unauthorized occupants or pets because of COVID-19. For example, if you are caring for a loved one's children or pet because that loved one is in self-isolation due to COVID-19, that is no longer an authorized reason for an eviction. The rules standardize the way tenants must give notice to their landlords and prevent anyone from requiring a different type of notice. The rules prohibit landlords from imposing new pass-throughs during the moratorium or charging late fees, interest, and any related charges for the unpaid rent during the moratorium that accrued during the moratorium and all the way through the repayment period. For the county's unincorporated area only, so if you don't live within a city jurisdiction, you're in the county's unincorporated area, you're subject to the county, and you are subject to the county's rent stabilization or mobile home rent stabilization laws. There is a rent freeze in place until the moratorium ends. Landlords cannot raise rent during this time. Tenants, you do have some obligations under the applicable rules. You must have a financial impact related to COVID-19. A financial impact can be a substantial loss of income, a reduction in hours, a job loss, or extraordinary out-of-pocket medical expenses. And your financial impact is related to COVID-19 if it resulted from a COVID-19 diagnosis, a business closure, a public health order, loss of child care, or similar reasons. Tenants are encouraged to deliver notice to their landlords in writing. It doesn't have to be a fancy letter on letterhead. An email will suffice. Your landlords may be seeking financial assistance, mortgage forbearance, or things of that nature. Something in writing from their tenants will help them to demonstrate their need. The Department of Consumer and Business Affairs is developing a self-certification form. This will be up on the website later today. Residential tenants can use this form to provide their landlords with the requisite notice. If you are a small business with 10 or fewer employees, you can also rely on the self-certification. Let me address just a common question that we get all the time. Does this mean tenants don't have to pay their rent? Not exactly. This is a moratorium period. This is not a get-out-of-rent-free period. Tenants will have to repay any past due payments, any past due rent, for up to 12 months after the moratorium period ends. And tenants, of course, are encouraged to pay all or part of their rent during the moratorium if they are able to do so. I mentioned at the top of my remarks, this moratorium is designed to help those who are suffering economic hardship as a result of COVID-19. If that is not you, please keep up with your rent obligations. How long will the rules be in place? So Supervisor Solis mentioned the moratorium is in place until May 31st, at least until May 31st. It may be extended by the board if necessary, and the period is retroactive to March 3rd. And of course, also as Supervisor Solis mentioned, we know that while many tenants are suffering economic hardships, landlords are as well. The County Board of Supervisors announced yesterday it will be establishing rental assistance programs that will help both tenants and landlords cover rent and expenses during the moratorium period. The Department of Consumer and Business Affairs has also expanded our existing programming to meet the needs of landlords who are facing a financial hardship or are unable to collect rent during the moratorium period. For landlords with fewer than 15 units, 15 or fewer units, the Department of Consumer and Business Affairs can help you prevent a foreclosure and help with loan modifications if you are experiencing a COVID-19 related economic hardship or income loss. For landlords and tenants, establishing a payment plan for back rent is a best practice and certainly provides clarity and a course of action for both the landlords and the tenants to follow. The Department of Consumer and Business Affairs is reconfiguring our mediation program. Typically, we do a ton of in-court mediations with the court closures and reductions. We have mediators on standby that can offer neutral, facilitated discussions between landlords and tenants to resolve disputes and establish repayment terms. Please take advantage of this opportunity to have a facilitated, voluntary, non-binding discussion with your tenants or your landlords to resolve some issues you may be experiencing. If you're a tenant who is being threatened with eviction at this time, get in touch with us. get in touch with us right away. We can help you counsel. We can help counsel you on your rights or your obligations, and of course, our counsel is always free. If you're a landlord and you need information on your rights or you're facing a financial hardship yourself, again, contact us at the Department of Consumer and Business Affairs. We are expanding our call center every day to meet the demand. Our calls are rising every single day. We've had a huge inflow of support from our county departments who have provided us volunteers to staff the phones. We are expanding to Saturday hours as well to help those who need to contact us over the weekend. I know I threw a lot of information out there today. There's simply no way to reduce it down. It is a lot of information. So I'm going to give you now the phone number and website that Supervisor Solis also gave you for our LA County Disaster Help Center. This is your one-stop shop for landlord and tenant issues. Everything I mentioned today is online for your review, and we can walk you through telephonically any questions that you have. The phone number for the Help Center, 833-238-4450. The website, lacountyhelpcenter.org. There is a landlord-tenant button. Just click that button and it will pass you through to the landlord-tenant page. And of course, you can always visit LA County's COVID-19 webpage at covid19.lacounty.gov. With that, I will conclude my remarks, and I believe, Anna, we are ready for questions.
Sure. Ladies and gentlemen, at this time, if you would like to ask a question, please press 1 followed by 0. If you would like to ask a question at this time, please press 1 followed by 0. And our first question comes from Steve Gregory with KFI News. Please go ahead.
Thank you, and good afternoon, everyone. I don't know if Madam Chair Barger is there or if Ms. Solis would like to answer. I wanted to find out how many of the departments in the county have been classified as non-essential, if any employees have been furloughed in a way to save money, and if any county executives are going to do a voluntary pay cut in sort of the spirit of a lot of companies and other entities have been doing to help save money, at least in light of what came out today, this morning, about the funding issues. And also for Dr. Ferrer, I wanted to ask, there seems to be a lot of confusion about modeling and how it's being applied. In a conversation with Dr. Lewis yesterday, sort of implied that the numbers that you used for your model in the beginning were sort of an overreach on numbers and that he's going to have to retool the modeling again. I'm wondering if you know when you can expect a new modeling system to come in place and how your decisions moving forward might be impacted by that. Thank you very much.
Okay, I am here, County Supervisor Hilda Solis, and I believe your question was with respect to employees being furloughed. At this time, I'm not aware that any employees from the county have been furloughed. I do know that many of our county employees are in isolation or they're working from home. They're telecommuting, and I think that is honorable. But there are many, many individuals that have been reassigned because they are essential workers and they are out helping us in our testing sites, whether that is also providing assistance to seniors, congregate meals, or they're helping us establish our rapid response to many areas, especially dealing with homelessness. So I really want to commend our employees for some stellar work that they're doing. I know that at this time we are all going to be looking at what implications this has on our budgets. I know that many of our department heads are working I would say almost 24 hours. I hate to say that, but you can tell that our department heads are very diligent, and they are also working together to redirect staff when necessary to help them get to places where we find that there may be more need and assistance. So I hope that answers your question. We'll have more information, I think, in the weeks and the month ahead when we see our revenue as it comes in through sales tax, property tax, and what have you. But needless to say, all of us have to tighten our belts here, and the county will also follow suit. Thank you very much for your question.
Our next question comes from Patrick Healy with NBC4 News. Please go ahead.
Thank you very much. A couple of questions for Dr. Ferrer. Number one, I heard you talking about the possibility of easing the restrictions late May. Could you be more specific about that timetable? And could you also comment on how this would work? Would the county consult with Sacramento first, need to get a green light from Sacramento, Or do you see the counties moving individually on this? Thank you.
Hi, this is Christina Galley. I'm going to actually take the last part of the previous question, which we didn't get a chance to answer, and then we'll answer the question that you just raised. So the previous question, the last part, was with respect to modeling. I didn't catch the name of the specific model that you were looking at, but with respect to the county's model for the data we presented last Friday, that model is being continuously updated, and we'll release new slides and new data on that model every Friday. So that will be made available on a continuous basis, and we'll keep updating those numbers with what's available from the Department of Public Health as well as the EMS agency. The second part of your question was about how that information would be used. And just as it was explained and laid out in the governor's framework yesterday, and I know the local public health department under Dr. Ferrer's leadership has a very similar framework, the ability of the healthcare system to be able to take care of the projected number of patients is one of the factors in the governor's framework. There were 6 factors, but it's one of the factors that will be looked at in terms of being able to lessen the physical distancing measures and safer at home measures that have been put into effect. It's by no means the only factor. There's other things that will be taken into account in terms of steps moving forward about what can be done to help reopen things in society and get people back out in public. But that model specifically looks at the outcomes and the ability of the healthcare system to manage cases, and that's one of those key factors that we'll be looking at. We'll move to the next question then. That was the one that was just asked.
Yeah, this is Barbara. Thanks a lot for your question. I'm just going to sort of note, we do work very closely with Sacramento. I don't think, this isn't probably an instance where anybody wants to, sort of do something that's not well coordinated across the state. But every county does have its unique circumstances and unique situations. So we all work together. We talk almost every day with our partners at the state level and with other partners across the county. So that we're understanding how decisions are getting made. I think everyone is doing exactly what we're doing here in the county, which is trying to really plan for recovery and using the data that we get every day to guide, at what moment in time does it really make sense to start relaxing some of the social distancing requirements and some of the requirements on closures. All of us would like to see people getting back to work. All of us are feeling very hopeful that the efforts we've taken to date actually have made a difference. They've actually slowed the spread. So I think everyone is where we're at. We're hopeful that May, certainly the middle of May, the latter part of May, becomes a time where we can put in place actions that allow us to start thinking about relaxing some of the health officer orders. We're going to use time from now till then, though, to really look at our data and be cognizant that we have to be driven by what we're seeing in each of our counties so that, again, we make the best decisions possible on behalf of the safety of all of us who live here and work here in the county. And we'll take the next question.
Our next question comes from Claudia Rashudia with KNX News Radio. Please go ahead.
Hi. Barbara, I was wondering if you could provide any preliminary results on the first round of antibody testing. My understanding was that there would be preliminary results by today. Also, can we get a total number of county employees who've tested positive? I'm wondering if there have been any deaths and how many are in isolation and quarantine. What percentage is that of the county's workforce? And also there was mention of a shelter that had 3 cases, so that would count as an outbreak. I'd like to know which shelter that is. Thank you.
Sure. The last question, it's the Union Rescue Mission, and in fact, we've been working really closely with them we found out yesterday that they had another positive case there. So we're making sure that everybody is appropriately isolated and quarantined. I want to thank Andy Bales and his team. That's a really large shelter, and they made a lot of adjustments to try to make sure that everybody who's there is safe. Your other question about county employees, I don't really have a definitive way to track county employees who are positive. If there's been an exposure at a work site, then it's likely that that supervisor and that department has some knowledge about that particular case because there were some actions that needed to be taken at a work site. But there are many people who were exposed elsewhere, never exposed anybody at their work site, in which case we might not have that information, and it may be reported separately. You know, people do not have to disclose any medical information when they, in fact, are ill. So there's no way for us to know as people are using their sick time, et cetera, that they've had they're a positive case for COVID-19. So I don't think you're going to get any accurate number for that. I want to say that the county, like every other business, takes every effort to protect all of the employees here and to make sure that all of the orders on isolation and quarantine are adhered to. Thank you for that. And preliminary results. Yes, so it's a good question. I don't have preliminary results today. We were hopeful, but there's a lot of data there. But we are hoping that we'll be able to report either Friday or Monday with some of the information we've already gathered from that first round of serology testing. We'll take the next question.
Next question.
Sure, one moment. And Mary Beth McDade with KTLA, your line is open for question.
Oh, great. Thank you. And I have a couple of questions. One is regarding the masks. Just wanted to get clarification. Do people need to be wearing them when they're out exercising? I know that goes into effect today, so I just want to clarify when and where people need to wear them. Also, I'm wondering if the IHME model out of the University of Washington, it says that we're going to see our peak hospitalizations on Friday and deaths on Monday. Are you guys using that model? And then also, as far as when we're reopening, I mean, the state right now has an indefinite period as to when everything's shut down. I mean, I'm guessing that LA County cannot reopen anything until the state reopens?
Yeah, I'll take your last question first. So you're absolutely right. The governor's orders apply to the entire state, and his deadline is no deadline. He, like everybody else, I think, is using data to inform decisions. And it really gets to what I was talking about earlier. You know, we are working very closely with the state and the other counties on the recovery plans. But you're absolutely right. We're all under the governor's orders. I mean, we have orders here that are specific for our county that, in fact, may go further than the governor's orders, but we're not allowed to relax any of the governor's orders in advance of the governor relaxing them. So thanks for reminding all of us that we do operate as a state here in terms of needing to adhere to the executive orders that are in place around distancing. I love that you asked me a question about the face coverings. It's really important because the orders do go in effect at midnight tonight. The order requires everybody who lives in LA County, and I believe that both Long Beach and Pasadena health departments have issued, their health officers have issued a similar order. It does require that if you're an employee at any of our essential businesses, your employer needs to provide you with a face covering if during your day, your job duties have you in contact with other employees and or with the public. It also requires that all of us in the general public who want to enter into an essential business need to also cover our nose and our mouths with a face covering in order for us to go into those businesses. And as a reminder, that face covering protects other people from your respiratory droplets. So again, this is trying to make sure at essential businesses we're being as mindful as possible about the need to protect each other and particularly to protect the essential employees that go there every day so that we can have the goods and services that are so necessary for our survival. I do want to note that that's the order for LA County, and we've been very clear that if you are outside by yourself in your backyard, you're taking a solitary walk, you're taking a solitary run, you're not with other people, there's no need for you to put on that face covering, because the face covering is to protect other people you come in contact with. If you're going to be riding on our buses or our trains, if you're going into places and spaces where there are other people, please put on that face covering. That only makes sense. You're protecting other people when you put it on. But if you're all by yourself, absolutely, you can put it on if you want to, but you're not required to put it on in those situations. Thank you for that question. We'll take the next question. Oh, sorry, actually, Dr. Galley will answer the question on modeling.
Hi, just briefly on the modeling question, the slides that we went through on Friday are available on the county and the DHS website, and you'll see that it differs somewhat from the University of Washington model, which I realized showed a peak that was on Friday. The model that we've developed does not currently map mortality, though that's something that we'll be adding into it in the future. Rather, it looks at total hospital beds, ICU bed capacity, and ventilator capacity, and it shows that there was a shift in the curve when the physical distancing measures went into effect that had a pronounced impact on the shape of the curve, but that the trajectory of that curve is still gradually upward. So because of that, we're not showing the same peak that the University of Washington model did show. And as I mentioned previously, we'll be updating those numbers with a new set of slides available on Friday. Next question.
Our next question is from Maloney Mason with LA Times. Please go ahead. One moment, please. Your line is open for questions.
Thank you. I have two quick questions for Dr. Ferrer. The first is with regards to information around COVID cases for healthcare workers. Will it be possible to get the names of the institutions where these infections occurred, much like you do with nursing homes and other institutions? And then the second question is with regards to COVID-related medical sheltering operations. In an alert that was put out yesterday from the Emergency Operations Center, it said that the Dockweiler RV park location had 0 clients at it, and I'm just wondering if there is any more information about that particular location. Thank you.
Yeah, thank you so much. So Dockweiler is closed, and because there are facilities that are relatively close by that have opened. So yes, you're right. There's 0 patients at Dockweiler. All of the people that were at Dockweiler have been transitioned to one of the other quarantine and isolation facilities. So we've opened a lot more facilities, and it was easier to provide the kind of services and support in the other facilities. So that site is closed. And the question around, do I have information on healthcare workers who have tested positive for COVID-19 by the name or the site of their facility, and I don't have that information. We have thought about different ways of looking at issues related to healthcare workers, but at this point in time, we're not capturing the information we're capturing the information more by the healthcare worker, the type of job that the healthcare worker is doing, and their exposures, than we have been capturing it by facility. But I will take your question back to our team, and when we do our next healthcare worker report, which we do once a week, we'll see if we can figure out ways to give more information. I'm not sure we'd ever be able to do it by facility, but I'm assuming what you're trying to figure out is whether or not there are outbreaks in facilities, and we may be able to better understand that issue separately. But we'll take the last question now.
And our last question comes from Olga Gregorians with Los Angeles Daily News. One moment. Your line is open for question.
Go ahead.
And Olga, your line is open for a question.
Hi, good afternoon. We hear from women who are switching to giving birth at home because they fear to have their newborn exposed to the virus in hospitals, and I wonder if it's a concern. And we also know how valuable personal protective equipment is these days, and what is being done to make sure that women and their babies are protected. That's my first question, and I also have another question about Los Angeles Jewish home. And we learned that recently about 100 residents got tested, and I wonder if there are any plans to test other employees and residents. And can you please explain how you're able to test so many people at once? Thank you.
Hi, this is Christina Galley. I'll take the first question and then I'll turn it to Dr. Ferrer for the second question. So with respect to where a woman chooses to go through labor and delivery, I mean, first I would just say that it's obviously a very personal choice. There are many options that are available to people, and people should choose the option that they feel like, in consultation with their medical professionals, is right for them, given their goals of their birth experience, given any medical conditions they may have, as well as other factors. I do want to make sure that people are aware, though, that hospitals have very strict infection control guidelines. They have strict, among the strictest infection control guidelines at any point in time, but certainly even in the context of COVID, all of those have taken on a much higher level of vigilance. There's additional protocols that have been put in place and guidance by public health departments with respect to personal protective equipment, decontamination and cleaning procedures, and I know that hospitals are all very vigilantly following those. And so I feel like if a woman chooses and would prefer to give birth in a hospital-based setting, it is safe to do so. They could always make sure that they're asking questions on a hospital tour, which many hospitals do offer, so that they can become familiar with the policies and procedures in place in the specific hospital that they would choose to give birth in. It's always a great opportunity to learn more about the hospital and what they're doing, and have a chance to ask their questions and get answers and become comfortable with things. But I think people should have a high degree of confidence in the ability of healthcare and hospital settings to maintain those infection prevention and control guidelines and keep people safe. And they shouldn't be in concern that either they or their baby would be unduly exposed to COVID-19. I firmly believe that hospitals are very safe places and continue to be safe places to receive care, including labor and delivery. And then I'll turn it over to Dr. Ferrer for the second question.
Sure, and thanks a lot for the question on the LA Jewish home and whether or not there was targeted testing there. We'd have to check with the facility. I want to be honest that some of the facilities are able to do their own testing, and we applaud those facilities that have that capacity. In some of the facilities where we've had outbreaks and there is no capacity to do testing by the facility, the Department of Public Health has in fact stepped in to do testing, or we've arranged for there to be testing. But I don't have a specific answer on what's exactly happening with their testing at that facility. So thank you. We'll go ahead now and have remarks in Spanish.
Buenas tardes. Soy la supervisora Hilda Solis, representando el Condado de Los Ángeles. Quiero agradecer la ciudad de El Monte y muchos de los voluntarios y el Condado de Los Ángeles, porque hoy día abrimos un centro de pruebas, y estos días que van a pasar van a poder ir a tocar y tomar una prueba. Pueden ir al número 211 para conseguir información. A los 7 días, empezando a las 9 de la mañana hasta las 5, pueden ir y tener esta prueba. Tenemos pruebas cada día hasta 350. Entonces, es muy amplio y podemos también decir que queremos las otras ciudades que quedan ahí cerca en la región, que por favor vayan ahí también, aplican en el internet o hablan con el número 211 para conseguir más información. Pero también le quiero compartir información sobre más programas que está ofreciendo el condado para ayudar a personas que rentan su hogar o para los negocios pequeños. Ayer, la Junta de Supervisores del Condado de Los Ángeles aprobó mi moción para proteger a más residentes y asegurar que no les echen en sus casas porque tienen dificultad pagar su renta en este momento. Esta acción va a proteger la salud y seguridad de las miles de familias en todo el condado y asegurar que se pueden quedar en sus casas en este tiempo. Las protecciones ahora se aplican en todas las ciudades del condado, menos las ciudades que tienen su propia protección contra el desalojo. Ahora van a tener hasta 1 año para pagar su renta vencida. Y si vive en una área no incorporada del condado, no le pueden aumentar su renta. Con estas protecciones queremos asegurar que no van a tener que decidir entre pagar la renta o poner comida en su mesa para su familia. También ayer la Junta de Supervisores aprobó un programa de asistencia de renta para las personas que han perdido su trabajo. Vamos a ofrecer ayuda mensualmente por 3 meses a las personas que perdieron su ingreso por parte de la pandemia o de coronavirus. También queremos ayudar a los dueños de propiedades y otros negocios que necesitan apoyo durante esta crisis. El condado se ha unido con Goldman Sachs para dar $15 millones en préstamos para negocios que necesitan pagarles a sus trabajadores. Más información sobre este programa está en el Centro de Ayuda del Condado en lacountyhelpcenter.org. El condado también está ofreciendo hasta $20,000 a ciertos negocios que necesitan pagarles a sus empleados y cubrir otros gastos. El condado también tiene un programa para ayudar a los dueños de propiedades que tienen pagos atrasados. Podemos ayudar a modificar sus préstamos. Puede aprender sobre toda esta información en el condado de ayuda por internet o llamando al número 833-238-4450. Nuestros departamentos del condado están trabajando muy duro para ofrecer asistencia a todos los que necesitan. Por favor, llamen o vayan a lacountyhelpcenter.org. Muchísimas gracias a todos ustedes. Ahora me da bastante gusto presentar a la doctora de Salud Pública, la doctora Barbara Ferrer.
Buenas tardes a todos y muchas gracias, Supervisora Solis, y a toda la Junta de Supervisoras por proteger la salud y la seguridad de todo el condado de Los Ángeles durante este tiempo sin precedente. Para actualizarlo sobre nuestros números actuales, hoy estamos tristes de reportar 42 muertes adicionales. 24 de estas personas son mayores de 65 años y 13 personas mayores de 65 años que fallecieron tenían problemas delicados de salud. 11 personas tenían entre 41 y 65 años y 7 de estas personas tenían problemas delicados de salud. Una de estas personas tiene entre 18 y 40 años y esta persona también tenía problemas delicados de salud. Esto eleva el número total de muertes a 402 en el condado de Los Ángeles. Y nuestra tasa de mortalidad para COVID-19 es 3.8%. Lamento mucho la pérdida de vida y para todos los que han perdido familiares y amigos de COVID COVID-19, nuestros pensamientos y oraciones están contigo todos los días. Hoy también estamos reportando 472 casos nuevos. Hay 10,496 casos totales en el condado de Los Ángeles. Y estamos reportando 28 casos confirmados entre personas sin hogar. La mayoría de estas personas no tenían refugio. 6 que fueron protegidos están apropiadamente aislados y los contactos cercanos están en cuarentena. Los 2,704 casos han sido en algún momento hospitalizados, el 26% de todos los casos positivos. 1,501 están hospitalizados actualmente. El 31% de estas personas están en la unidad de cuidados intensivos y el 19% están en ventiladores. Puedes ver más informe actualizado de los casos del condado en Los Ángeles en el sitio web del Departamento de Salud Pública en publichealth.lacounty.gov. Actualmente estamos investigando 205 entornos institucionales con al menos un caso confirmado de COVID-19. Hay 7 investigaciones adicionales desde ayer. Estos incluyen hogares de ancianos, instalaciones de viviendas asistidas, refugios, centros de tratamiento, viviendas de apoyo e instalaciones correccionales. El total de casos confirmados en entornos institucionales es de los 1,764. Esto incluye 940 de casos confirmados que son con residentes y 824 casos que son con empleados. Publicamos una lista de instalaciones con casos confirmados en nuestro sitio de web una vez que han notificado a todos el personal, las residentes y las familias. Nuestros equipos del Departamento de Salud Pública están trabajando actualmente con todas las instalaciones que tienen un caso positivo y la gerencia y el personal están haciendo todo lo posible para proteger la salud de sus residentes. Más de 67,000 personas han sido evaluados por el COVID-19 y se reportarán resultados en el condado de Los Ángeles, y el 11% de ellos fueron positivos. Quiero hoy hablar un poco más sobre cómo será la recuperación aquí en el condado de Los Ángeles. El pedido más seguro en el hogar es nuestra herramienta para mitigar la propagación del virus en nuestra comunidad. Es decir, ha disminuido la propagación y ha impedido que las personas se infecten. Y les agradezco a todos por el papel que han desempeñado al hacer todo esto. Pero tenemos otro esfuerzo clave, y esto es la contención del virus. Y lo que significa es que se debe realizarse como una prueba generalizada y que aquellos que han sido infectados pueden aislarse y sus contactos cercanos pueden someterse en cuarentena. Entonces, en el futuro, cuando relajamos nuestra mitigación, nuestras medidas de contención deben seguir vigentes. A medida que se abren más empresas, las cosas seguirán siendo diferentes. El distanciamiento físico seguirá siendo muy importante. Las tiendas se pueden abrir en un tiempo en el futuro, pero habrá límites sobre cuántas personas pueden estar allí al mismo tiempo para garantizar que las personas pueden mantener la distancia. Nuestros sitios del arte y cultura volverán a abrir, pero los eventos pueden estar libres de espectadores y las exposiciones requerían distanciamiento físico. lo que significa que habrá menos personas capaces de estar allí al mismo tiempo. Los senderos pueden ser una vía para que las personas mantengan una distancia física entre sí. Verá prácticas del control de infecciones, como lavarse las manos, usar cubiertas de tela para la cara y distanciamiento físico requerido en lugares públicos. Relajaremos las órdenes de forma segura y evitamos que las personas entren en contacto entre sí. Nuestro objetivo es lograr que la mayoría cantidad de personas pueden volver a trabajar, pero también tenemos que proteger a los empleados y los clientes. Continúa haciendo su parte. Manténganse conectado con su comunidad desde lejos. Sea amable con usted mismo y muestra compasión el uno por el otro. Y así llegaremos al otro lado en estos juntos. Y ahora viene Analu Fernandini de Consumer y Business Affairs para hablar del trabajo que ellos están haciendo.
Les queremos recordar que si hay personas en la línea que tienen preguntas, por favor marquen el 0 y después el 1. Nuevamente, si hay personas que están en la línea y tienen preguntas, por favor marque el 1 y después el 0. Gracias.
Buenas tardes, mi nombre es Analu Fernandini y yo superviso la Unidad de Estabilización de Renta del Condado de Los Ángeles, que está dentro del Departamento del Consumidor y Negocios del Condado. Primero que nada, me gustaría decirles que sabemos que hay frustración, ansiedad que están sintiendo las personas que viven en el Condado de Los Ángeles, que rentan o son dueños de propiedades. Mucho ha sucedido en un corto plazo. Y como gobierno estamos haciendo nuestro mejor esfuerzo para responder a esta crisis de manera rápida y apropiada. El día de hoy me gustaría darles más detalles acerca de las extensiones en las protecciones a los inquilinos que fueron extendidas por nuestra Junta de Supervisores el día de ayer. Estas reglas establecen que los dueños de propiedades de renta e inquilinos deben seguirlas en todo el condado. Estas reglas se aplicarán a todas las tenencias residenciales y comerciales y a todos los inquilinos que rentan espacios en casas móviles en todo el condado y en cada ciudad, a menos que esa ciudad ya haya adoptado su propia moratoria del desalojo. Esto significa que si usted vive en una ciudad que ya ha establecido una moratoria del desalojo, no estamos cambiando las reglas para usted. Alrededor de 35 de nuestras 88 ciudades ya tienen reglas establecidas. Estas ciudades están listadas en nuestra página web. Si usted vive en una de esas 35 ciudades, repito, que ya tienen una moratoria, la información del día de hoy no aplica a usted. Las reglas, los cambios no aplican a usted. Estas reglas, anunciadas por la Junta de Supervisores, están diseñadas para evitar que los inquilinos residenciales y comerciales y los inquilinos de casas móviles sean desplazados o desalojados si no pueden pagar el alquiler debido a una dificultad relacionada con COVID-19. Como dato adicional, los alquileres comerciales incluyen unidades de almacenamiento. Si usted es un inquilino comercial y tiene una unidad de almacenamiento que utiliza para su negocio, o si usted es una empresa de almacenamiento, también está cubierto por la moratoria. Las reglas protegen a los inquilinos para que no puedan ser desalojados si tienen ocupantes o mascotas adicionales que no están permitidas, pero esto es debido al COVID-19. Por ejemplo, si una persona está cuidando a las mascotas de familiares o seres queridos mientras estos están enfermos con COVID-19, esto no es un motivo para un desalojo. Las reglas estandarizan la forma en que los inquilinos deben notificar a los propietarios y evitan que hayan requerimientos diferentes. Las reglas prohíben que los propietarios impongan nuevos costos durante la moratoria o que cobren tarifas por retrasos, intereses o cualquier cargo relacionado por el alquiler no pagado durante el periodo de reembolso. Solo para las áreas no incorporadas, si está sujeto a las leyes de estabilización de renta o estabilización de las casas móviles del condado, existe también un congelamiento de la renta hasta que finalice la moratoria. Los propietarios no pueden aumentar el alquiler durante este tiempo. Para los inquilinos, ustedes también tienen responsabilidades y obligaciones bajo estas reglas. Sus pérdidas financieras tienen que estar directamente relacionadas con COVID-19. Una pérdida financiera puede ser pérdida sustancial de ingresos, reducción de horas, pérdida de trabajo o gastos médicos excesivos y que tuvo que pagar de su bolsillo. Sus pérdidas financieras están relacionadas con COVID-19 si son el resultado de un diagnóstico de COVID-19, el cierre de negocios, por una orden de salud pública o la pérdida de cuidado infantil o razones similares. A los inquilinos se les recomienda que envíen un aviso por escrito a su arrendador. No tiene que ser una carta elegante ni oficial. Estos avisos pueden ser a través de un email o a través de un texto. Muchos propietarios estarán también buscando asistencia financiera, tolerancia hipotecaria. Estas peticiones por escrito por parte de sus inquilinos les ayudarán a demostrar su necesidad. El Departamento de Asuntos de Consumidor y Negocios está desarrollando un formulario de autocertificación que los inquilinos residenciales podrán completar para proporcionarlo a sus arrendadores. Las pequeñas empresas con 10 empleados o menos también pueden usar esta autorrecertificación. Este documento estará disponible en nuestra página web por la tarde. Permítame también contestarles una pregunta frecuente. ¿Esto significa que los inquilinos no deben pagar renta? No. Esta moratoria no es una extensión de alquiler. Este no es un periodo libre de alquiler. Los inquilinos tendrán hasta 12 meses después de finalizar el periodo de moratoria para pagar sus rentas atrasadas. Recomendamos que los inquilinos paguen toda o parte de su renta si les es posible. Como dije anteriormente, esta moratoria está diseñada para ayudar a aquellos que sufren dificultades económicas por COVID-19. Si este no es su caso, usted debe mantenerse al día con sus pagos de alquiler. Entonces, ¿cuánto tiempo estará vigente estas reglas? Por el momento es al menos hasta el 31 de mayo. Y espero estas reglas pueden ser extendidas por la Junta de Supervisores si es necesario. De antemano sabemos que si bien muchos inquilinos están sufriendo dificultades económicas, los dueños de propiedades de renta también lo están. La Junta de Supervisores del Condado también anunció ayer que establecerá programas de asistencia de alquiler para ayudar tanto a los inquilinos como a los propietarios a cubrir el alquiler y otros gastos durante este periodo de dificultad. El Departamento de Asuntos del Consumidor y Negocio también ha ampliado los programas existentes con el fin de satisfacer las necesidades de los propietarios que no pueden cobrar el alquiler durante el periodo de moratoria. Para los propietarios de 15 unidades o menos, el Departamento del Consumidor y Negocios puede ayudarle a prevenir una ejecución hipotecaria y puede ayudarlo con una modificación de su préstamo si está experimentando una pérdida de ingresos relacionada con COVID-19. Es recomendable que los propietarios e inquilinos establezcan un plan de pago para las rentas atrasadas. Esto proporciona certeza tanto a los inquilinos como a los dueños de propiedades. En el Departamento de Consumidor y Negocios estamos reconfigurando nuestro programa de mediación para poder facilitar discusiones neutrales entre propietarios e inquilinos con la finalidad de resolver conflictos y establecer las condiciones del reembolso. Estas son mediaciones no vinculantes y voluntarias, pero tenemos excelentes mediadores, tanto en nuestro personal como voluntarios que estarán felices de ayudarlos. Si usted es un inquilino amenazado con el desalojo, comuníquese de inmediato con el Departamento del Consumidor y Negocio. Nosotros podemos asesorarlos sobre sus derechos y obligaciones de forma gratuita. Si usted es un arrendador y necesita información sobre sus derechos, o si usted mismo enfrenta dificultades financieras, llámenos. Estamos ampliando nuestro centro de llamadas diariamente. Hemos recibido gran ayuda por parte de voluntarios de otros departamentos del condado que nos están ayudando a contestar los teléfonos. Sepa siempre que estamos aquí para ayudarles. Yo sé que hay mucha información el día de hoy, pero no hay forma de reducirla. Hay mucha información que compartir. Ahora les voy a dar el número de teléfono y nuestra página web de nuestro centro de emergencia del condado de Los Ángeles. Este es un sitio de recursos centralizados para asuntos de propietarios e inquilinos. Toda esta información que mencioné el día de hoy está en línea para su consulta. También podemos asistirlo telefónicamente con cualquier pregunta que tenga. Aquí está la información de nuestro centro de ayuda. Nuestro teléfono es el 833-238-4450 y nuestra página web del centro de ayuda es lacountyhelpcenter.org. Aquí también en esa página web hay un botón específicamente diseñado para propietarios e inquilinos. Este es un portal de recursos donde van a encontrar la información acerca de las reglas que acabo de mencionar. Por supuesto que siempre puede visitar la página del condado para COVID-19, que es covid19.lacounty.gov, para obtener toda la información más reciente. Anna, we're ready for questions.
And again, ladies and gentlemen, if you would like to ask a question, please press 1 followed by 0. Our first question comes from Gonzalo Alvarado from CNN Español. Please go ahead.
Hello.
Gracias, thank you. Esta pregunta sería, bueno, ya está para la doctora Ferrero, la supervisora Solis. Gracias por la oportunidad. Quisiéramos saber que nos hablaran un poquito más sobre la nueva ordenanza que entra en vigencia a partir de esta noche de miércoles en cuanto al requerimiento de portar las mascarillas en vía pública. Si nos puede hablar un poquito más a qué sitios son donde las personas tienen que usarlas y las que no lo hagan, si habría algún tipo de multa por parte de la policía o el departamento del sheriff al no cumplirlo. Muchas gracias.
Sí, aquí está la doctora Ferrer.
Sí, muchas gracias por la pregunta. Sí, es a medianoche de hoy empezamos con una directiva que todos los que están trabajando en los trabajos esenciales, los empleados, todos tienen que tener sus máscaras de tela cuando están allí trabajando con otros empleados o están trabajando atendiendo a gente que vienen de afuera a comprar algo o sacar un servicio. También la gente del público, nosotros también tenemos que usar estas máscaras de tela cuando nosotros entramos a cualquier sitio donde hay trabajo que están haciendo, que son trabajadores esenciales. Esto es como las tiendas de cualquier tienda de compras, si estamos buscando servicios sociales. Si nosotros vamos a entrar a un sitio donde estamos buscando estos servicios o queremos hacer unas compras, tenemos también que tener un cubierto sobre la nariz y sobre la boca, una máscara de tela. Si nosotros estamos caminando así en la casa o por atrás de la casa o por la calle, estamos corriendo y estamos solos, no tenemos que tener estas máscaras de tela puestos, pero si estamos con otra gente que no son gente que en la casa donde estamos viviendo, sí tenemos que usar estas máscaras de tela. Por favor, le pido a todos que nos ayudan y que usen esas máscaras cuando están afuera y están cerca de otras personas. ¿Tenemos tiempo para otra pregunta? Una más pregunta. Sorry, one more question.
¿Quién más? In English? You have a question? Anna?
And our next question comes from Raymond Mesa with Telemundo 52. Please go ahead.
Raymond Mesa from Telemundo 52. Una pregunta para la supervisora Solis o tal vez para Ana Lu Fernandini. Hemos recibido muchísimas llamadas acerca de este plan para ayudar a inquilinos y quería saber que se quedara en claro esto. ¿Van a ayudar a personas sin importar el estatus migratorio? Y si se están otorgando $1,000 al mes, ¿cómo pueden asegurar que este dinero va a ser utilizado para pagar renta y no para otras necesidades básicas que tal vez estén surgiendo?
Mira, ayer aprobamos muchas medidas para ayudar a la comunidad, especialmente renteros y personas que tienen negocios. Y sabemos que ellos pueden dar datos si están impactados por parte del coronavirus. Por ejemplo, cerraron sus puertas de negocio o, por ejemplo, una familia no pudo trabajar porque estaban ahí en sus casas porque no hay trabajo. Eso también es un impacto del coronavirus. Entonces pueden dar esa información ya sabiendo que están impactados y también pueden documentar eso. No necesitan tener pruebas que son ciudadanos si por caso ellos piensan que van a tener un problema. Entonces aquí estamos, pueden llamar también al número 211 y si no a la Oficina de Asuntos Inmigrantes para coger más información. Pero ahorita le voy a pasar a la representante de la Oficina de Consumidores. Ana.
And there are no further questions in queue.
Ok, relacionado con la pregunta de la ayuda financiera, el Condado de Los Ángeles está trabajando en ese programa. Todavía no tenemos detalles específicos acerca de cómo la ayuda financiera va a ser distribuida, pero nuestra Junta de Supervisores ya la ha aprobado y muchos departamentos están trabajando en ella. Si alguna persona tiene alguna pregunta relacionada con su situación migratoria y si si este tipo de ayuda les va a poder beneficiar, pueden llamar a nuestra Oficina de Asuntos de los Inmigrantes, que también está bajo nuestro Departamento del Consumidor. Pueden ustedes usar nuestra línea centralizada, pueden llamarnos al 833-223-7368. Una vez más, pueden llamarnos al 833-223-7368. Si tienen alguna pregunta para nuestra Oficina de Asuntos de los Inmigrantes, si quieren saber más información acerca de beneficios para todos. Now we're going to listen to remarks in Armenian.
Բարի երեկո։ Կուզենք թարմացնել լեյ շրջանի ընթացիկ ղարքավիճակի վերաբերյալ։ Մենք այսօր ցավով կհայտնենք հետևյալ 42 անձերի մահվան մասին, որոնց 24-ը 65 տարեկանից բարձր էին, իսկ 13-ը նրանից հիմքում ունեին այլ առողջական վիճակ։ Իսկ 11-ը նրանից 41-ն 65 տարիքի մեջ էին և 7 նրանից հիմքում ունեին այլ առողջական վիճակ։ Դերակություն մենք չունենք մյուս 6 դեպքերի մասին, քանի որ դրանից 3-ը հայտնվում են Լոնգ Բիչի քաղաքում, իսկ մյուս 3-ը Պասադինա քաղաքում։ Սա հանգեցնում է Լոս Անջելես շրջանում մահացությունների ընդհանուր թվին 402-ի և մեր մահացության մակարդակը COVID-19 համար կազմում է 3.8 առ 100։ Ամեն օր, երբ մենք հայտնում ենք այս թվերը, մենք գիտենք, որ կան ընտանիքներ և ընկերներ, ովքեր սկում են իրենց սիրած մեկի գորուստը։ Դուք մեր մտքերի և աղոթքների մեջ եք։ Այսօր մենք հայտնում ենք նաև 472 դեպքերի մասին։ Վերջին 48 ժամվա ընթացքում գրանցվել է 1142 նոր դեպքեր։ Ընդհանուր առմամբ LA County-ում կա 10,496 թեփք։ Այս թեփքերը ներառում են Long Beach քաղաքում մեր կորձընկերների կողմից գրանցված 363 թեփքեր եւ Pasadena քաղաքի կողմից գրանցված 179 թեփքեր, որոնք ունեն անկախ առողջապահական բաժանմունքներ։ Հոսպիտալացման տվյալները 2704 թեփք հոսպիտալացվել է, որ կգազմի բոլոր դրական թեփքերի 26%-ը։ Ներկայումս 1501-ը հոսպիտալացած են։ Այդ մարդկանց 31%-ը գտնվում է ICU intensive խնամքում, իսկ 19%-ը օդափոխիչների վրա։ Տեստավորում LA County-ում ավելի քան 67,000 մարդ փորձարկվել է եւ ստացել են արդյունքների մասին լուրը, որոնց 11%-ը դրական է։ Ծրագրում ապաքինման համար։ Մինչ մենք խոսում ենք այն մասին, թե ինչպես դրական աստեցություն է ունեցել ավելի անվտանգ տանը, դա նշանակություն ունի, որ այն տանտաղեցրել է տարածումը։ Եվ մենք ուզում ենք բոլորին շնորհակալություն հայտնել, որ կարևոր դեր ունեցաք կանխելու այս հիվանդության տարածումին։ Մեր համարեցրու ջիկը վիրուսի զսպումն է։ Գարիք ունի լինել տարածված տեստավորում, եւ այն, որը վարակվել է, կարող է ինքնամեկուսացնել ինքզինք եւ բոլոր անոնք, ում հետ մոտիկից շփվել են, նրանք էլ պետք է կարանտինում լինեն։ Նույնիսկ եթե բիզնեսները վերապացվեն, ամեն ինչ տարբեր պիտի լինի։ Օրինակի, մանրածախ խանութները կարող են բացել, սակայն սահմանափակ մարդկանց թիվով, փորձելով պահպանել 6 ոտնաչափ հեռավորություն այլ մարդկանցից։ Հեծանիվի արահետները գուցե մեկ կողմանի լինեն, պահպանելու նաև 6 ոտնաչափ հեռավորություն այլ մարդկանցից։ Ինչպես կարող եք պաշտպանվել COVID-19-ից։ Ուրեմն սոցիալական հեռավորություն պահպանեք։ Մնացեք տանը, բացառությամբ անշուշտ, եթե անհրաժեշտ է, ինչպիսիք են սնունդ քնելը կամ բժշկի այցելելը։ Խուսափեք մարդաշատ վայրերից։ Փորձեք պահպանել 6 ոտնաչափ հեռավորություն մյուսներից։ Լվացեք ձեռքերը օջարով եւ ջրով առնվազն 20 վայրկյան, հատկապես զուգարանից օգտվելուց հետո, ուտելուց առաջ, քիթը մաքրելուց, հազալուց, բրշտալուց հետո, եւ եթե ձեռքի տակ օջարի եւ ջուր չկա, առնվազն 60% սպիրտային հիմքով ձեռքերի ախտահանիչ օգտագործեք։ Հազալիս եւ բրշտալիս ծածկեք քիթը եւ բերանը անցերոցիկով։ Ապա նետեք անցերոցիկը եւ ամնիջապես մաքրեք ձեր ձեռքերը։ Սահմանափակեք հիվանդ մարդկանց հետ շփումը։ Երեսը փակեք գդորով, երբ տնից դուրս գաք։ Պետք չունեք N95 թիմակ օգտագործել, եթե ախտանշաններ չունեք եւ կամ չեք խնամել COVID-19-ով վարակված հիվանդի։ Մաքրեք եւ ախտահանեք հաջող ցեք դրվող առարգաները եւ մագերեսները օգտագործելով սովորական կենցաղային մակրոմիջոցներ եւ կամ թաց անցերոցիկներ։ Կխնդրեք, որ դուք անեք այնինչ, որ ցեզ կվերապերի։ Մնացեք կապի մեջ ձեր գաղութի եւ անոնք, որ հերույ են ցեզ մե։ Ազնիվ վարվեցեք միմյանց եւ գարեկցակ ցույց տվեք իրար։ Միասին պիտի անցնենք մյուս կողմը։ Եթե դուք հարցեր ունեք ու կցանկանայիք ինչ որ մեկի հետ խոսել բժշկական օգնության կամ հոգեկան առողջության ծառայություններ գտնելու հարցով, զանգահարեք Լոս Անջելեսի շրջանի դեղեկատվական քիդզի 211, որ աշխատում է 24 ժամ շաբաթը 7 օր։ And this concludes our briefing for today. Thank you.
And ladies and gentlemen, that does conclude our conference for today. Thank you for your participation.